I'm Dr. Sam Mann, and this is Beyond Conventional Medical Thinking. Today's topic relates to hypertension, and I will be doing a number of podcasts about hypertension for a couple of reasons. First of all, it's my area of specialization. And second of all, a large majority of the American population above the age of 50 has hypertension and are on treatment, and we can do better. The topic for today's conversation is measurement of blood pressure. And my contention is that it's clear that in many, many, many cases, blood pressure appears higher than it really is. And there might be, as a result, overtreatment in many, many people because of this inaccuracy in blood pressure measurement. So I'm going to talk about why does this happen and what we can do about it. First of all, there are many things that are gotten wrong widely. The first thing is every guideline says blood pressure should be measured after sitting quietly for 5 minutes with your arm on a tabletop and your legs on the ground, feet touching the ground. And this is not happening. And I think most of us experience when we walk into a doctor's office, they immediately take you into a room, sit down, measure your pressure without waiting. And that's a problem because it takes a few minutes to settle down, and every guideline is clear. Patients should be sitting quietly for 5 minutes and then take 3 readings about a minute apart. Another problem is anxiety during the blood pressure measurement. And this can be anxiety, this can be what's called white coat hypertension, where the blood pressure is elevated during measurement in the doctor's office, but not at home. And certainly here, this is an important reason why for people who are being treated with medication for blood pressure, they should be checking their blood pressure at home as well. And again, put on the cuff, sit down, put on the cuff, wait 5 minutes, and take 3 readings, a minute apart. Another example where this is a major problem is, for example, among pregnant women and in mid-pregnancy or early, nearing the 7th, 8th month, they get an elevated blood pressure reading. Sometimes that can be because they didn't wait or because they were anxious. And then when they're told, well, you better sit here for a half hour and let's check it because this could be trouble, you can almost guarantee the next reading will be as higher. And I've had any number of patients who were pregnant who had a normal blood pressure in my office and then came to me and said their pressure was very high at the obstetrician. And I repeated it and it was normal. And fortunately, we were able to avoid unnecessary medicine that could have lowered blood pressure too much. Again, it's important to measure blood pressure at home to confirm that. Cuff size, obviously, somebody with a larger arm should have a cuff that's larger. Cuff should be placed above the elbow, about an inch above the elbow crease. Again, I want to emphasize the importance of measuring the pressure at home, but it's important how you check it at home. And there are a number of important aspects. One, of course, wait the 5 minutes as described. Second question is how often to check it. And there's no need to check it every day. One important thing, when we wake up in the morning, our blood pressure is higher than it is the rest of the day for the first half hour or so. I would not recommend checking it in that first half hour, but checking it at other times of the day, morning, afternoon, evening. I do not recommend checking it 3 times a day because it becomes obsessive and it can affect the readings. But one doesn't have to check it 3 times a day. One can check it on a Monday morning, a Wednesday evening, a Friday afternoon. So you sample different times of the day without checking it multiple times. And frankly, when a patient tells me they've been checking their blood pressure 3 times a day, I tend to discard all their readings because it is affected by the focus on that. Rarely, I mean, if the pressure is very high, it requires more often readings, but otherwise I would avoid excessive frequency of checking the blood pressure. Coffee. Does coffee raise blood pressure? In some people it does, in others it doesn't. I would recommend not having a cup of coffee before you see your doctor. If you want to know if the coffee affects your pressure, you can do the experiment at home. Measure your blood pressure, have your cup of coffee, and then measure the blood pressure again an hour later and see if there is a difference or not. If there is a difference, it could affect the pressure for hours, usually not a great amount, but somewhat. You can do your own experiment. Blood pressure variability. Everybody can have an elevated reading here or there. What's most important is what is your blood pressure most of the time? Wrist devices, cuffs that measure the blood pressure from the wrist. Generally, they're not considered as reliable as arm cuff measurements. They need more data on it, but at this time, I wouldn't recommend the wrist devices unless there's a problem measuring it with the arm. Next, what about automated devices? Now, when people measure the pressure at home, they use an automated device that measures it. In the doctor's office, more and more and more pressure is measured with an automated device rather than with the auscultatory measurement with a stethoscope listening to the pulse as the cuff is inflated and deflated. That can be a problem. I mean, the first question is, are the automated devices accurate? And I believe usually they are, but not always. And I'll describe what I experienced with regard to that over the years. So not infrequently, a patient can come in and their blood pressure is normal, is one level in my office and higher at home. I'll tell them, bring your monitor in next time, and I'll compare them in my office. And I find that most of the devices are accurate. And if the pressure is near normal, they're pretty much in line with each other. But when somebody has an elevated pressure, there can be a difference between the two. So for example, if somebody's pressure is, let's say, 165, which is clearly significantly elevated, and they come in and they bring in their device, measure it on their device on one arm, and they get 180, 190. And on the other arm, I measure it and I get 160. It's elevated, it needs more medicine, but it's not as elevated. And I used to tell them, buy a new monitor because it's overreading. Then gradually, thinking about it, I decided to do an experiment. Patient comes in with their automated device, it was 180, and on the other arm, I got 160, 165. Clearly a difference. But this time I did something different. I did an interesting experiment. I said, okay, and when I switched arms, the same result. So I tried an experiment. While you check it on your automated device on one arm, I'm going to check it simultaneously on the other arm. And when we did it simultaneously, and this is very interesting and doesn't exist in the literature, on their device, they got the 190. And when I listened on the other arm, I got 190. So the blood pressure was higher than it was when I measured it without the other arm being measured. And I wondered why. And the only conclusion I could come up with is that the automated device is accurate because mine was the same when done simultaneously, but the automated device must be a cause of elevation of the blood pressure. And that's why they're getting that higher reading. And again, this is not with people who have a normal blood pressure, but people who have a high pressure, it overstates it. And this is important because, for example, when people go to the emergency room, the pressure's high because they're nervous. And ER docs generally, pressure 180, they'd send you home because they see that all the time. But if your pressure goes up to 180 and on their automated device it's 210, they may admit you to the hospital. And it's important that they check it with the regular ausculted measurement. And that's becoming less easy to do because more and more the auscultatory measurement technique is being discarded as it's more and more being done with the automated. So it can result in overstatement of high blood pressures. The other experiment that I did is I got a 190 with the automated and a 165 with mine. And then I tried an experiment. The automated device, the measurement is much slower. The device increases the pressure on the arm, and you see the pressure on the monitor go up and up slowly, slowly up to 200, and then slowly, slowly come down. And it takes a while. When we do it auscultatory, we do it much quicker. And in that time that the compression of the cuff is increasing all the way above 200 and then coming down, which it does when somebody's pressure is high, it's painful. Patients wince, it hurts. So one possible reason that the reading is higher is because they're in pain. There's a second possible reason. When the compression goes up and up and up and then slowly down and down, that whole time, the brachial artery is compressed. That arm is getting less blood flow and maybe even very little blood flow. That can cause an autonomic reaction, stimulates the sympathetic nervous system and raises blood pressure because the arm is being deprived of blood. And the longer it takes for the device to have the pressure go up, 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 and then down, 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 that's a problem. So one solution is then to check it with the non-automated, with the manual measurement. A possible answer to this, and there's no data on this whatsoever in the literature. Another possibility is there are some automated devices that measure the blood pressure during inflation of the cuff. So, for example, if your pressure is 170, it'll inflate 140, 150, 160, 170. Well, by the time it gets to 175, 180, it stops because it realizes you're at the systolic pressure and then it comes down. So it doesn't inflate as high or as long. And that's a possible solution to this, but we need more data on that. Finally, 24-hour automated blood pressure, where the doctor, at the doctor's office, they'll place a cuff on and it'll take a reading 2 or 3 times an hour over 24 hours and less frequent at night. That measures the pressure at home, asleep, awake. It's a wonderful tool. Better than relying on the blood pressure in the doctor's office, which is a brief moment and also often affected by anxiety, the white coat effect. You do want to check your pressure at home. Often just measuring it yourself is enough. If there's any question as to what your usual pressure is, then the 24-hour monitor is worth getting to see what your pressure is and how is it during the day and at night, and it gets all that data. One shortcoming of it is that, yes, you are aware that it's doing the measurement. And for the first 3 hours or so, some people get higher readings. And then finally, they just get tired of getting alarmed over it and it settles. So first 3 hours can be unreliable, but after that, it's pretty reliable. Step in the near future, they will have a device that you attach to the skin that measures blood pulsation, or arterial pulsation, and measures blood pressure non-invasively. And it does it continually. So you don't even know when it's measuring the pressure. You're completely unaware of it. And that, I think, would be the next step in 24-hour blood pressure monitoring. It's a beautiful technology. It's being perfected, and it will be available more and more in the near future. So that's one other means of measuring blood pressure. And finally, a warning, the manual blood pressure measurements, the device, they are being phased out in doctors' offices and in hospitals, and they might disappear. They still exist. In our office, we always used that, but in most offices, they don't. And when they do disappear, then we have to be much more careful about how we measure blood pressure with the automated devices. That concludes this discussion. If you have any questions, you can contact me for Q&A through my website. My website is drsamuelmann.com. And if you click the header that says podcasts and then put in your question, and I'll try to answer some of the questions at the end of future podcasts. Also, if you are a physician or if you know someone who is a physician who would like to add to these podcasts by joining me because they have findings that they would like to convey, also please contact me through the website drsamuelmann.com podcasts. I would appreciate if please feel free to share this podcast with others. And again, encourage others to subscribe. I think you'll find information very important and valuable. Subscription is free. Do mention it to other doctors to see if they would be interested in joining me for some of the sessions. In general, there will be a new podcast the first and third Wednesdays of every month. The next topic will be attention deficit and hyperactivity disorder. And it'll be a very interesting type of treatment that is not used and not studied and has been effective with a number of patients I've seen with ADHD. I think you'll find it very interesting. Thank you.